Dr. Lucinda Halstead is an otolaryngologist and medical director of the Evelyn Trammell Institute for Voice and Swallowing at the Medical University of South Carolina. She's also president-elect of the Performing Arts Medicine Association and a laryngologist for the Spoleto Festival. Let's move and talk to Dr. Halstead and ask her, for some of her thoughts about what we've heard from Dr. Milton and some of the things she has to add to our conversation.
Okay, well, I've really enjoyed getting to meet and know Dr. Milton a little bit. It's been an incredible experience because I'm really a clinician and not a basic scientist. So I'm going to try to share some of the things that I think are important to take away from his wonderful research, and how can we apply it every day. I think that the most important thing, and the reason that we are here, is that all of us are passionate about the voice, and especially the singing voice. And we're here today because your souls are crying out to express themselves. And what we're going to hopefully do between Donald and I and all of your questions and all of the expertise we have here is to try to see what we can do to keep things safe. So Alan asked me, what does your visit to your laryngologist look like in the age of COVID-19? So here I am in my office before the pandemic. This is what you're going to see when you come to my office. So we do rapid PCR polymerase testing for the virus, and at our institution we have a 3 to 5% false negative rate, which means that 3 to 5% of the people that come in with a negative test are actually positive. Okay, so that's on the patient side. Now, as you can all see, I'm just an ingenue. No. So for my age group, which is in the 60s, I have about a 15% chance of dying of this virus if I get it. So what our infectious disease people have said, since I'm going to be in your airway, looking down into your throat, that I need to be protected. So I have glasses on, I have an eye shield with a special splash veil that I've designed. I have an N95 mask. I have a droplet proof gown, and obviously I'm wearing gloves. Okay, so I will tell you right now, and some of my colleagues who really know me know that I'm almost never hot or warm. This is warm. In fact, most people would say it's hot. It's a very hot outfit, and we're going to go into some of that when we talk about, what can you do when you're singing and what you can't do with that. Dr. Milton has gone into this in great detail, and he had actually shared with us on Sunday that there are many, many outbreaks, even some in South Korea that were very bad, that really started in churches where you have a large number of people who are singing loudly. They're exchanging air, and we don't know what the ventilation is in many of these places. And I would just, again, then say, think about your practice rooms. Think about the college dormitories where, the only ventilation you have is opening the window. So there's the aerosolation, but then there's also the transmission of viral particles off the surface that you do need to be aware of, because people are passing folders around, they're passing music around, they're touching, they're kissing, they're going to the bathroom, they're touching all the doors, all of those different things that you do need to be aware of, simply because you're going to take your hands and without thinking about it, you're going to put them on your face. As a surgeon, we're trained way in the beginning that if you need to cough or sneeze, you do this because your hands are sterile, okay? But that's not an intuitive way to cough or sneeze. The most intuitive way is to put your hand over your face. So then you have this, and you can then go touch your neighbor and begin part of that in addition to the aerosolization. So I think that it's a real a real thing. It's not just simply one or the other, it's a combination. And I just put up a couple of pictures. You can see in Gianestici, people are really in each other's faces and they're singing rather loudly. We have the Westminster Choir, and how would you space them out so that you had 6 feet in between each of them? You would need a football stadium. So these are technical challenges to you as performers as to how we can get an artistic message across when we have all of these challenges of distance and separation. So this was in the New York Times just the other day, and it just really crystallizes everything that Dr. Milton has talked about in terms of this miasma of particles traveling from, this was the index case right there, traveling across to infect. And they showed that, again, you can see in the number of feet that it goes, 16 feet. So how are you going to get the Westminster Choir out there and to perform, and how acoustically is that going to impact the audience when they're that far away from each other? So these are real problems, and they're, these are problems. The problems, my personal feeling, and I think a lot of the literature that's coming out, Bill Gates just wrote a really good article about it, is it's not going to be only social distancing, which can flatten the curve, but we do need a lot of testing. We need vaccines. We need other treatments in order to be able to shrink that social distancing safely. That's the key, safely. Currently, the PCR polymerase chain reaction testing is extremely sensitive. In our institution, there's a 3 to 5% false negative. A lot of it had to do with, we were using a different test before, but when we got the PCR test, things got better, and the people doing the test were a lot better. Now, many of you have probably already read the article by Bill Gates that came out a couple of days ago talking about different kinds of testing. And one of the things that he is talking about and trying to develop is something called a rapid diagnostic test. Now, before we get all excited, because this is a little swab you can stick just in the anterior part of your nose versus going all the way back and feeling like somebody just put an ice pick in your brain, that it's not as sensitive as the PCR test. Okay, so until it can be as sensitive as the PCR test, and you also need to be symptomatic for it to be positive. It's not safe. It would not be the easy, safe thing. Now, they are working on some different tests, and they're trying to get them to be as sensitive as the PCR test. And that, I think, will be a major advance if it's something like Bill Gates is talking about, having it almost like a home pregnancy test, where you could just take it, and I'll show this to you, take it to the choir, and we're going to talk about a potential way to screen safely. So what are you going to need? Really, I mean, because I deal in your airways, I'm relatively sensitive to, dying. We really need a vaccine developed. It's probably going to take about 18 to 24 months. Usually people in the US are not that patient. There are some new drug treatments coming along, but if they're not overall efficacy of 95% or better, it's not going to help us. But they're working on it, and hopefully in 6 to 12 months we will see some more developments in that area. Until then, social distancing is is key. Mask, gloves, spacing is going to be really ideal. So when I think of how you can come back into a group situation and have the least amount of risk, this would be my scenario. That first of all, you all have to agree that the risk is never going to be 0. You need to assume 3 to 5%. Okay. You screen at the door. It would be wonderful if this home PCR test becomes something that could be a gold standard, and it's not now, it's still under development. And that people come in and there is a person, either the assistant choir director or somebody affiliated that is not a member of the choir, comes in, you do your little test in a private space, they watch you do the test. If it's negative, they ask you the questions, they do a temperature check. And one of the other things that has been very, very sensitive is looking at people's O2 saturations with a pulse oximeter. So those kinds of things are really important right now. And for not in a group setting, but for you as an individual, it's good to know what your temperature is. And especially if you have underlying pulmonary disease or cardiac disease, to know what your resting pulse oximetry is. So the pulse ox, the temperature check is, we consider a fever anything, a normal temperature is less than 99.4. 99.4 and above, at our institution, you get sent home. A pulse oximetry check that's below 94% starts raising questions, okay? But there's a lot of people with asthma, COPD, and heart conditions, and just general aging who come trotting in around 94%. So that's why it's very important to know what you are first. But if you're at 99% and you're not feeling well and you get a pulse oximetry and it says that you're 89 or 90 or 92, you probably would want to go and get a COVID test. No question. But that does bring up really important issues about privacy. Who's managing this data? How can you de-identify it enough that you find out exactly, everybody gets tested, but instead of recording everything, you say, okay, on the initial eval, everybody in the choir passed. So they had a normal temperature, they had a normal pulse ox, they were PCR negative. They come in the next time and you go, all it says on the sheet is choir member A, check, they passed. Choir member B, check, they passed. Doesn't have any personal information on there. And and everybody, it could be your name, it could just be a number, it could be a letter. You mix it up so that nobody really knows. You don't go down the choir row going A, B, C, D. Don't do that, so that people don't really know who you are. So, but these are real issues. These are things that we can aspire to. We don't have it now. We don't have this now. Now, this is what a lot of people are talking about. And I'm going to just say it's high risk. Okay. Again, you all have to buy into it that you're going to be way above the 3 to 5% false negative with this. There's just a screening criteria at the door for symptom screenings, temperature check, pulse oximetry. There's a lot of a problem with that, just because, as Dr. Milton said, there is a lot of people who spread this virus while they're completely asymptomatic for 24, 48 hours, okay? So that would be a real problem, because, everybody, you could pass this and still be highly contagious, okay? and then you're together for 2 or 3 hours. I had a lot of people saying, well, I can sing with a mask, or is there some sort of barrier that you can use? Okay, so thinking back to what I wear when I'm examining a patient or doing surgery on a patient now, I have an N95 mask, I have goggles, I have eye shield with a droplet resistant barrier that comes down and tucks into my gown, okay? And so it's short of having like the space hoods that the orthopedic surgeons use to go in and do joint replacements. But they also have an O2 supply that is on their belt that circulates air for them. There's no circulation in here for this. So there are no barriers that are currently safe for singing, because as attractive as an N95 mask is, it's like, oh, nothing gets through there. So nothing goes in, nothing goes out, unless it's not completely fit tested. So you have to go and have somebody put the mask on you. They look at how it fits. They have you breathe in and out. And then what they do is they aerosolize a bitter taste. And if you can taste it, then that mask does not fit you. So that's how a fit test is done. And there's a lot of people wearing, the vast majority of people who are walking around with N95s are not fit tested. There is a recirculation of breath. There are studies that were put out like in 2014 to look at what happens if you're doing normal breathing in an N95 mask, not singing for sure, but just some talking and moving around, what happens in an hour. And your O2 levels decrease while you're wearing that mask, and the CO2 levels that you're rebreathing are going up, okay? So by the end of the day, I have a really nice headache. And like I said, most people would find this garb hot. I find it warm, going toward hot, but that's because I'm very cold natured. But when you think about it, I'm in very good health. Most of you are in very good health, but we do have people in our congregations, in our choirs, that are not in good health. They have asthma, they have COPD, they have heart disease. If you put something like this on them, it would be a tremendous strain on their physiology, on their hearts and their lungs, and could be extremely dangerous. So, it's a great tool. It's a great medical device, and using it, if it's not fit tested, is just about as good as wearing a regular mask. So, other barriers. We've heard some wonderfully imaginative and very well thought out solutions to how can I sing without wearing a mask. And all I can say is that there is not one, unless you're wearing the mask or the hoods that the orthopedic surgeons wear, which are essentially spacesuits with an oxygen supply, that would really do it for you. People have talked about veils. Most of the material out there is not droplet proof, so forget that. They talk about, well, what if we sprayed it with a disinfectant? We see hundreds of patients in the emergency room who just with cleaning their house will get toxic exposure and burns into their respiratory tract from the bleach solutions that they're using to clean their garage or whatever. So that is not, it is really the wrong thing to do. Again, if you had a veil, it would have to be closed at the bottom. And if it was impervious to droplets, again, you would be like in that N95 environment with it decreasing O2 and increasing CO2 as your practice continued, which again could be very, very dangerous. So these are they're wonderful ideas, and people have, sent me lots of different suggestions. And I love it because then it makes you think out of the box, is there a better way? And right now, I really don't see one. So we're back to being patient. One day we will get back to having choruses and orchestras and audiences. The time is going to come because the ingenuity of all of our fantastic researchers have put so much effort into this. It has gone, the research and the technology that is driving this and the achievements that they've made are stunning in this small amount of time. When you think of December and we're just starting into May, that's an amazing amount of technology and energy and talent that has been put forward to this with incredible advances. I would say that the last thing that, again, we had kind of talked about, but I see as people are walking around outdoors or in buildings, is to remember the hands, because you never know who just sneezed and pushed the elevator button. So, for example, I get out of my car to go into the hospital. I put gloves on, and I usually have a paper towel with me so that I can carry my satchel, and all I need to do in this hand, I can open the door, I can press the elevator button and have an extra layer of protection between the glove and that surface. So by the time I get to my office, I can drop that, and I have 2 clean gloves that I can then take off, and my hands are clean. Okay, so paranoia, maybe, but it is one way to protect you and to also decrease the number of people, contaminants onto that surface. If everybody, good glove technique is really hard. It's very hard to keep your hands in the right place. I find it hard to keep my hands in the right place. So these are just some of the things that I think are so important. And I can't stress how much I miss hearing all of you sing. I can hardly wait for it to happen again, but I'd rather have a full chorus of 120 people or 80 people versus a chorus of 40 people, because that's all that's left in the choir.